by Mr. Sam. He's administrating this call. He's our administrator, or as you know. Today we are going to look at research designs. Yes, I don't intend to delay here because this is not so much a huge issue. However, it is very important as far as research is concerned. So, research design. Can we go to the next slide, Mr. Sam? Yes, those are our lecture objectives. By the end of this lecture, you must be able to discuss terms used in research design. You must be able to understand the benefits of research design. You must be able to discuss research designing process and to discuss various designs. You must also be able to discuss research as well to discuss bias as well as the types of bias in research. Mr. Sam, can we go to the next slide? Yes, under the definitions in research design, the definition of research design is the framework of research methods and techniques used by a researcher to conduct a study. Yesterday we saw that the first process in research is identifying a problem. Yes, without a problem, there's no research. You get it, eh? But the next step is now coming up with research design. It's like a strategy. They are like procedure that you're going to be following when conducting your research. You get it, eh? Yes. Another point is that the design allows researchers to sharpen research methods. I've told you that the design process is a systematic and structured approach to conduct research. Systematic in a way that the procedure, the steps, what steps are you going to follow when conducting this research? The process is essential to ensure that the study is valid, reliable, and produces meaningful results. Here, you try to be like a produce systematic in a way that it has steps. Within this design, you try to come up with what will you obtain, what will you produce in the end. After the research, what shall we be finding? You get it, eh? Yes. Let's go to the next slide. Okay, other terms that we use in research, we use variables in research design. Yes. A variable, those are the characteristics, or you can call it the attributes. Yes, sometimes we call them the factors that can take on different values and can be measured or manipulated or controlled during a study. Yesterday, I told you of my research. My most recently published research is called the prevalence of hypertension and risky factors associated with hypertension. In my research, I looked at demographies, for example, age, sex. You get it, eh? Yes. I also looked at when I looked at sex, I also looked at whether someone has ever had a blood pressure testing. You get it, eh? Those who have ever had blood pressure testing, what was the reason? Was it antenatal care? Was it medical checkup? You get it, eh? Yes. So those become the factors, eh? Those become the variables that are considered during research. I request the Unzima to mute, please. Unzima, your microphone is producing background noise. Unzima. Okay. Yes, thank you for that. Let's go to the next slide. Oh, we have also the variables, the types of variables, the independent variables. This is very important because for any research, you must look at the variables. And these variables have two types. We have the independent variables and then the dependent variables. The ones which are independent, they are those variables that are manipulated or controlled by the researcher to observe its effect on the dependent variable. You get it, eh? For example, smoking. You get it, eh? During a research, I can perform a certain study and I want to subject a certain group of people to cigarette smoking, and then the other group I don't subject them to cigarette smoking. So cigarette smoking becomes an independent variable. You get it, eh? Yes. And the effects of this variable are depended on by the dependent variable. We are going to see the dependent variable. Dependent variable that is observed and measured for changes in response to the independent variable. You get it? Eh? For example, coming and lung cancer. Lung cancer depends on developing lung cancer depends on cigarette smoking. You get it? Eh? So in case of any study, I will have lung cancer as the dependent variable. In case the study's title was the effect of cigarette smoking on lung cancer. You get it? The independent would be cigarette smoking. Yes? And then the dependent would be lung cancer. Why is the cigarette smoking considered independent? Because it cannot depend on lung cancer. You will not first have lung cancer to start cigarette smoking. You get it? Eh? However, the effects of cigarette smoking can cause lung cancer, meaning getting lung cancer becomes dependable on cigarette smoking. That is the difference between the two. Please understand me well here, because in research to be successful, you must know what are my independent variables, what are my dependent variables. This very research I'm considering of hypertension, high blood pressure. High blood pressure is dependent. What does it depend on? On age. You get it? Eh? Age can make increase in age or old age can make someone to develop high blood pressure. However, you'll not because you have high blood pressure, it does not mean that you are old. But being old can cause high blood pressure. I think now it is very clear. Good. Another one would be a control variable. However, this one is not a type as such, but it was an essential term that I had to add on. Control variables first way to go to that slide, sir. Yes. Control variables are those variables that are kept constant and controlled to prevent them from influencing the relationship between the dependent and the independent. You get it? Eh? I can go on to a village where I wanted to test the effect of lung cancer on the effect of cigarette smoking on lung cancer. Eh? Now, I will get the members who do not smoke cigarette. You get it? Eh? I'll get members who do not smoke cigarette. I put them in another area, and I see whether these members will develop lung cancer. You get it? Eh? In case we have members we have more members among those that were not subjected to cigarette smoking. In case we find more cases. You get it? Eh? In case we okay, let me repeat this. We have a group. One is subjected to cigarette smoking. One is not subjected. You get it? Eh? The one which is not subjected becomes the control group. Therefore, the control variable is not subjecting them to cigarette smoking. What shall we achieve in the end? Shall we have more lung cancer cases among cigarette smokers, or we shall find them among the non-cigarette smokers? The results tell us that in case we find more on cigarette smokers, it will mean that indeed cigarette smoking shall cause lung cancer. In case we find more on the other side who are not exposed to cigarette, therefore we shall conclude that developing lung cancer does not mean that you smoked a cigarette. I think it is clear. Let's go to the next slide. The process of research design. The first step is considering your aims and approaches. Determine the research here at this level of aims and then approaches. Here you need to determine the research questions and objectives and then identify a theoretical framework or the methodology of study. Yes, your aims. What are your objectives? What do you want to achieve in the end? Which results do you expect to achieve in the end? For example, in the study in the study of assessing the prevalence of and risk factors of high blood pressure among adults of 20 to 60 years, my objectives would be to determine the prevalence of hypertension, and the second objective would be to assess the risk factors of hypertension among adults in this and this area. So aims and approach. Approach is the methodology that you shall be following. You get it? Eh? Another one, choose a type of research design. We are going to see the respective designs and we are going to understand them more. That one I assure you. Therefore, choosing a type, we are going to see that indeed you must come up with a type of research design before you continue to progress on your research project. You get it? You're going to see the types. Don't worry there. The third step is identifying the population and sampling method. What is your targeted population? Yesterday I talked about that. Are you targeting neonates? Those ones are from birth to 28 days of age. Are you targeting children 0 to 5 years? Yes. Are you targeting adolescents 10 to 20 years? Are you targeting teenagers? Are you targeting mothers in childbearing age? You get it, eh? Yes, that is identify your population. And then the sampling method that you're going to use. In our this is our second lecture. But in the third lecture that we shall have tomorrow, it is going to be about sampling. And you're going to understand sampling in research. Let's continue, sir. The next slide. Fourth, choose your data collection methods. Yes, data. How are you going to collect the data? Are you going to just go and take an observation, you look around and then you mark on your checklist? Are you going to interview them? Are you going to go to your population, the one you have sampled out, and then continue to make an interview? Do you have a questionnaire that you're going to be filling? Is the questionnaire open-ended? Is it closed-ended? Is it a semi-structured questionnaire? You get it, eh? Yes. So we are going to see all those types when we are studying about data collection. Perhaps next week on Monday, we shall be looking at data collection. Sorry, not Monday, on Wednesday, because Monday is for psychology. So, which data collection method are you going to use? Are you going to use the key informants? Key informants in an area, those ones can be, for example, the VHT, the LOC1 chairperson, those people who have a lot of information regarding the history of the area. Those are the key informants. You get it, eh? So, data collection method is the key in research designing a process. Number 5, plan your data collection procedure. Yes, which steps are you going to use? Are you going to call them for a community meeting? Are you going to go to household? You get it, eh? Data collection procedure. Are you going to wait for the participants to come at your hospital and then you collect the data? Are you going to use the parents of those children? You get it, eh? Are you going to use the wives of those men? Are you going to use husbands of those wives? Procedure. How are you going to approach your participants? That's what I mean by plan your data collection. Then, which time are you going to take? Where are they located? You get it, eh? Yes. Who are the personnel involved? That I've told you. Are you going to use husbands of those women? Are you going to use wives of those men? You get it, eh? Yeah. Number 6, describe your data analysis strategies. How shall you analyze your data? If you enter it are you going to use the software? Software, for example, statistical packages. We have statistical packages. We shall see them when we are looking at data analysis. Perhaps next week as well. You get it, eh? How are you going to analyze your data? When you enter it in Excel, which procedure shall you use? You get it. Are you going to use percentages? Yes. Are you going to use perhaps something else other than percentages? For example, proportionalities and ratios. You get it, eh? Yeah. Let's go to the next slide. Let's go to the next slide. Yes. Elements of research design. Hello, I'm on kindly, I'm on, don't worry. Yeah, I was saying elements of a research design, eh? Yeah, I think we have understood the procedure and it's going to make it easy for us to understand the elements. Means of obtaining information. I've talked about that. I think I don't need to repeat that. Availability and the skills of the researcher. This is what I said yesterday. You must do research in your expertise. You get it, eh? You cannot be a nurse and then do something in dentistry. You get it, eh? You cannot be a public health officer and then do something in surgery. You get it, eh? Surgeons, expertise. Your fellow investigators, your co-workers in this research project. Who are they? What expertise, what skills do they possess? You get it, eh? That's what I mean by a bit of skills research. The objectives of the problem to be studied, that one I talked about it, but we shall understand it more when we are discussing research methods 2. I told you I would pull out something small and from research methods 2. So objectives, how to come up with objectives, this one we shall learn it and we shall understand. the nature of the problem to be studied. Yes, the nature of the problem. Does it affect the whole community? Is the problem contagious? I mean, is the disease you're investigating, can it be spread from one person to another? COVID-19. Yes, meaning you must, understanding this tells you the tools that you shall use. What tools shall you use? You need a face mask, you need sanitization in the area, not to spread the disease. You get it? Yes. So nature of the problem entails you on what tools you shall need, on what data collection method, on the sampling method. You get it? Yes. The availability of time and money for the research work. Money, resources. Do you have adequate resources for the research work? You get it? Do you have adequate resources? That is in terms of money. Can you transport yourself across the communities? I told you there are some researches that we shall wait for participants to come to my hospital. There are some researches that you go to household by household. There are researches that you just call on a community meeting through their LOC1 chairperson. You call a community meeting and then you investigate. You understand? So availability of time and resources and will help you to identify the resources, the time frame. You understand the tools that you shall need in the research process. Next slide. Benefits of the research design. Now we are trying to compare. In case someone has not used the research design, in case someone has used it, what do they stand? Clarity of research objectives. If you have a design, it makes it clear for the objective that you are going to follow. This gives you the aims and then approaches that you shall use. Increase validity and reliability. If you have a research design, we can easily rely on your research that indeed we can refer. Remember, if someone is going to make a research, they will try to go and use your research as a reference. Now, if you don't have a research design, it is really hard for an individual to rely on your research. Yesterday, we learned about primary and secondary data. Secondary data is obtained from previous researches. Now, if that research wasn't standard, if you didn't have a research design, how will other researchers rely on your work? You get it? Is it valid? You understand? Yes. Improve the data collection. If you have a design, I've told you with the design, you have the data collection procedure well represented, sampling procedure, community engagement. You get it? They are really, if you have a design, all these ones become easy. And then going to the next point, better data analysis. I told you that if you have a data analysis, it shows you the method that you're going to use. Are you going to use the manual methods? Are you going to use the software methods? Improve the communication. Improve the communication. Yes. You can easily communicate with your co-investigators, the people you work with, through a research design. Some researchers need supervisors. Yes. How will they know? Are you going to tell them by mouth the procedure you're going to follow? No. You just submit your research design and then they try to communicate with you out. Yeah, and then another fact on research design is that there is efficient use of resources because it allows you on planning. Yes, it gives you a better planning strategies, and then you use your resources efficiently. Another one is that a well-designed research plan is essential for successful research. Yeah, I think that point is clear. Providing clear and meaningful insight and ensuring that resources are practical. Let's go to the next slide. Characteristics of research design. Neutrality, first and foremost. Neutrality. Research design is neutral. In other words, it is not biased. It indicates everything clearly. You understand? Yes. It indicates everything clearly, and it indicates all the rights of your participants. Yes. Reliability, we have seen this, that it is reliable. It makes your research reliable. In case your research follow the design, other researchers can rely on it. Validity and then generalization. Yeah, all these are characteristics of a research design. It is valid. Yes, validity in a way that you have, remember, you have given it time, you have submitted it to co-investigators, you have submitted it to your supervisor. You get it? Yeah, and all of these ones have done a prior read through, which makes your work valid. And then generalization as well follows in the same context. Let's go to the next slide. The various research design. This is now the real thing on the research design. So research design can be analytical, can be descriptive. A research design can be analytical and can be descriptive. We are going to see how do you identify that my research is going to be analytical? How do you identify that my research is going to be descriptive? Analytical studies can be experimental or observational. We are going to understand all of these ones and how they happen to be under analytical studies. So experiments, we can perform lab trials. We can also perform field trials. Then under observational, it can be it can be a cross-sectional observational study. It can be a case control study. It can be a cohort study, and all of these ones are observational studies. Then we are going to see all the details of all of these. Don't worry on that. Descriptive studies, we have case reports, we can have case series, and then descriptive surveys. Let's go to the next slide. Analytical studies to start with. Analytical studies in research, that's the type of scientific investigation that aims to understand the relationship between different variables by analyzing data collected from various sources. On the next point, we say these studies involve the use of statistical methods and the techniques to examine patterns, trends, and associations within the data. Yes, here, analytical, it's like literally, like you hear it, analytical, this one even takes some good time. You run through a point, you run through a research problem. Yes, you try to analyze the causes. What is the etiology of this problem in this community? What are the high risk areas? What are the most susceptible groups? You get it? Also, analytical studies proceed to giving you a solution. You get it? Yes, and here you're seeing that the primary goal of analytical studies is to identify causal relationships between variables and make informed conclusions depending on the evidence gathered. That's why I've told you the first difference is that these ones will proceed to telling you, also giving you some solutions on how you're going to solve the problem. However, observational studies, like we are going to see them, for them they might just give you a report, but they will not give you other things. They will not do a follow-up. An example of an analytical study is a study to examine the association between smoking and then lung cancer risk. Just like that. A study to observe an association between smoking and then lung cancer risk. Let's go to the next slide. Experimental analytical studies. We are now discussing under analytical studies. So, scientific investigation that aims to analyze and evaluate the relationship between variables through controlled experiments. These are the experimental analytical studies. A researcher conducts an experiment to investigate the impact of a new drug on lowering blood pressure in the patients with hypertension. We shall get cases who are hypertensive. We shall bring them to a setting whereby we get the cases and then the non-cases. I've given an example of this. Those ones who are cases, we subject them to a certain drug which has been in existence. You get it? And then we also get another group which is hypertensive. We submit them to this new drug. You get it? I've told you, we get cases who are hypertensive, they have high blood pressure. We subject one group to the new drug. We subject another group to the old drug. And then we see which group clears the drug faster. That is a lab experiment. These studies involve manipulation of one or more independent variables to observe the effects on dependent variables. I talked about independent and dependent variables. I told you, for example, age. Old age might cause blood pressure, but it does not mean that because you have high blood pressure, it means that you have an old age. You get it? I gave that example, and I told you blood pressure becomes dependent while old age becomes independent. Experimental method, analytical methods can be lab trials or field trials. Let's go to the next slide and understand the difference between these two trials. Field trials involve testing hypotheses or evaluating effectiveness of interventions in real-world settings to assess their practical implications and potential impact. We shall go to a community and administer a certain vaccine and then watch the space. How does it, which result shall we get? You get it? We have, you see, COVID-19 initially, it was just a disease in one community, just on one individual. Later, it spread and it became an epidemic in the community. It then spread in the whole country, China, and it became an outbreak. However, because there were no proper interventional methods, it became a pandemic and it ended up affecting the whole world. You get it? Eh? Therefore, in a case I go into a community and the COVID-19 has become an epidemic, I've told you it becomes an epidemic in the community and then an outbreak in the whole country. So it has become an epidemic, and I've tried to come up with a certain vaccine that can prevent COVID-19. What I'm going to do, I'm going to do a massive vaccine administration, mass immunization, and I watch the space. What is the effect of this vaccine on the disease? Are we going to still get more admissions like we have been getting? If they reduce, it is successful. Those are field trials. So an example here is the impact of exercise interventions on cardiovascular health outcomes in older adults. We shall go to the community and then you'll have information on the prevalence of cardiovascular diseases in that community. Now, we shall subject this community to a mass physical exercise whereby all individuals who are cases are subjected to physical exercise every evening. After some time, we shall watch the space. What are the results? And then that shall be a field trial. Let's go to the next slide and we understand laboratory trials. So, lab trials involve conducting controlled experiments in laboratory setting to test hypotheses, analyze that, and then draw control. The difference here is that a field trial you will go to now the community. Here, lab trials you will do from the laboratory. What is the general difference? The general difference is that in lab trials, you might wait even for an admission, an admitted patient, and this patient is having lung cancer or prostate cancer. And then you try to obtain the stage in which this cancer is. Then you try to perform a certain a research on how you can perhaps reduce this cancer to develop into further stages. You get it? Eh? Yes. So that is the laboratory trials. So here researchers use laboratory trials to investigate effects of variables under controlled conditions, allowing precise measurement. You get it? Eh? Yeah. These trials are essential for advancing scientific knowledge and understanding mechanisms underlying various phenomena. An example I gave here is the impact of exercise on cardiovascular health in older adults, a randomized control trial. What is the difference from the field trial? I will wait for a patient who is having a cardiovascular disease to come to my health facility. When the patient comes, I now try to use his disease to learn more information on the perhaps the prognosis of this disease. This is how they understood most of these diseases, by the way. You get it? Eh? Most times in health here, you go to a community, you go to a hospital to start practicing health, but you have only a limited information on certain conditions. So what happens is that every patient you admit in your health facility, you learn more about their conditions. Every information you get, you utilize, you can summarize it, you can publish it, you get it. Eh? And remember, conditions are coming up every now and then. Yes? This is how they even invented most of the methods like kidney transplant. Very many cases could come to facilities with kidney problems. You get it? Eh? Now, an individual had to go deeper and deeper to understand all of these kidney problems and how they affect. An individual found out that we might fail to treat the kidney problem. However, we can perform a surgery and transfer the kidney. So what I'm trying to say, you wait for the patient to come to your facility, the patient with that condition, and then you learn more or you research more about the condition. Next slide, so that we can understand the observational. So, observational analytical study. So, these studies in research are a type of study design used in epidemiology and other fields to investigate the relationship between exposure or intervention and the outcomes. Before I go further, the example I gave here, I think you're seeing my examples down. On each method, I gave an example and I put a copyright on it, meaning that the study has been covered already. But at least I gave it as an example. The impact of smoking on lung cancer among middle-aged adults. What do you do? You subject a group of people to smoking. I think I've explained this in detail and you have understood. Subject them to smoking, and then in another group, you don't subject them to smoking. And then you watch both groups, the one which is exposed and then the one which is not exposed. You get it? So, and then you watch which one contracts lung cancer, perhaps faster. You get it? Yes. Also, we can also do these studies for interventional. You want to find out which drug cures more. You get it? So you subject one group to that drug who are cases, and then the other group you might not subject them, or you might subject them to another drug, and then you see which one clears the disease faster. I think that one is understandable. Let us understand more in the next slide when you are looking at categories. Next slide. Cross-sectional studies. These studies are designed to gather data from a specific population at a single point in time. Quote well, at a single point in time. These are the studies we do most in research. The study I have been using as an example, my own study, the prevalence of blood pressure among adults in this area. That was a 1 point in time research. I just went at that time and then I diagnosed all the members in that community who were having blood pressure. I diagnosed those with pressure, and then I obtained a percentage from those ones that I checked. I came up with a prevalence. That was a cross-sectional study because it was conducted at a point in time. Perhaps right now the blood pressure might have increased or even reduced, because during my study I tried to give guidelines to those that I found it would be cases. Unlike longitudinal studies, these unlike longitudinal studies that follow participants over an extended time, cross-sectional studies provide a snapshot of a population at that particular moment. You get it? For longitudinal, you'll have to take your time, watch the prevalence and incidence. Prevalence is what has happened, and then incidences, those are the new cases. Watch the new cases. You get it? Yeah, that's the difference between cross-section. Cross-section, you just do a 1 point in time assessment. Researchers use these studies to investigate the prevalence of certain conditions or behaviors, characteristics within the population, and then we try to identify association between variables. I told you, analytical studies try to find association. You get it? Yes. And then here, cross-sectional studies also, and analytical, they give you an association. However, the difference is that at that point in time. You get it? An example here is the relationship between smoking and lung cancer risk. You add the word a cross-sectional study. You see, we can have the same topic, but for different designs. However, it is always important for each design you use, you add that type of design. Relationship between smoking and lung cancer, a randomized control trial, that is for lab trials. Relationship between smoking and lung cancer, a cross-sectional study. You go to the community, you assess. You get it? Let's go to the next slide. Case control studies. These we are discussing and observational. For case control studies, it is even easy to understand. You have one group, you expose it, and then the other one you don't expose it, and then you see which one gets treated. You get it? One group becomes a case, and then the other group becomes a control group. These are the details. The case control studies are used to investigate causes of diseases or health outcomes. So in this type of studies, researchers study by identifying individuals with a particular disease or condition, and these are the cases. You get it? And a comparable group of individuals without the disease, these are the controls. You get it? Yeah. So the researchers then look back in time to compare the exposure history of the cases and controls to determine if there was an association between a specific exposure and the disease. For example, the association between alcoholism and mental health conditions. You get it? Eh? I will have my individuals with the mental health conditions, and I'll get another group without. Then I start asking, have you ever taken alcohol? Have you ever taken alcohol? Now, in case I get more alcoholics under mental health conditions than those ones without, then I'll conclude and say, indeed, alcoholism causes, exposure to alcoholism causes mental health problems. Even here, the association between smoking and lung cancer, I'll get those ones with lung cancer and those without. Then I ask about their history of smoking. Among those with lung cancer, I'll ask them, have you ever smoked a cigarette? And I'll get those ones who will say yes, and I'll get those ones who will say no. In case I get more yeses than among those who are not having lung cancer, then I will conclude that indeed cigarette smoking causes lung cancer. Let's go to the next slide. I guess you're getting the point, and I guess there is a certain topic that is starting to come into your head. I want that topic to come, and we start investigating it. You get it? Yes. We shall have sessions of presenting our topics, and then we shall know how we can best do it. Cohort studies. These studies are studies that follow up with a group of individuals over a period of time to observe and analyze the development of certain outcomes. This one now is can give you a snapshot on the pathogenesis of a certain condition. You get it? Eh? I can do a cohort study. Like you're trying to follow up on this group. You get it? Eh? Yes. I can follow up on a group for the next 5 years, or I can follow up for the group in the previous 5 years. We are going to see how the two are different. In cohort studies, researchers select a group of participants who share a common characteristic or experience and track them either prospectively to determine how this characteristic or exposure influences the occurrence of specific outcomes. Don't worry of the term prospective. We're going to understand it in the next slide. Cohort studies are particularly useful for investigating causes and risk factors associated with diseases or health conditions, as well as evaluating the effectiveness of interventions. I've told you it can help you to identify the pathogenesis of certain conditions. It can also help to identify the mode of action of certain drugs and the other examples in that line. Let's go to the next slide. Cohort studies, we are still on them. Now, here, this is now where the best key thing is. These studies can be either prospective or retrospective. You get it? Eh? Prospective studies, whereby the participants are identified and followed forward in time. I can go to the health facility and then identify my neonates. You get it? Eh? My neonates, those ones who are just born, or those ones who are below 28 days. I follow up on them in the next 5 years to see how we can reduce malaria incidence. I've told you incidence are those new cases. Prevalence are the cases who had the condition already. So I can go to a community, try to identify, I could go to a health facility, get my neonates, follow up on them in the next 5 years to identify who are the way, how we can reduce malaria incidence among newborn babies. I can also get the same group and try to monitor their growth. Under nutrition, you will study or you have studied about growth monitoring. Yes, measuring the upper arm circumference, measuring the heel to head length. You get it? Now we can monitor. We can do a growth monitoring that is under nutrition to observe how we can reduce malnutrition among children. Those studies I've given you are prospective. We do forward in time. You get it? The best example here is the association between smoking and lung cancer. We get members who at that point in time, no one has lung cancer. We just go to community. No one has lung cancer. You get it? Now, one group can be subjected to cigarette smoking. One group is not subjected. You get it? And then we watch the space. In the next 5 years, we come back and assess. Who are those ones who have developed lung cancer? Initially, no one had it, but some group started smoking. The other group is not smoking. So if we find more cases after 5 years among those smokers, then we shall conclude that indeed these ones are associated. I repeat, I'm using the same example, smoking and lung cancer, because I want you to get the difference in this design, that the same topic but a different design. That's why we said the design you're using matters a lot. Retrospective studies, where researchers analyze existing data on past exposures and outcomes. Now, these ones are done back in time, retro, going back. You get it, eh? Now, I'll get a group which has lung cancer. I think I've talked about this already. Group which has lung cancer and one which does not have. Then I ask about their history in exposure to smoking. That is a retrospective study. You get it, eh? Growth monitoring among children. I'll get children of 5 years, whereby I have those ones who are a bit malnourished, and then I ask on their exposures during childhood. You get it, eh? Where they have adequate patient care, and then I'll find out that malnourishment among the community, among perhaps the people of Elegu, the children of Elegu, comes from lack of patient care. But how have I done that? I went into a community, identified the malnourished children. Malnourished, you can assess it. Eh? Yeah, using, I've told you, upper arm circumference. I can use the waist circumference. You get it? Now, among the malnourished, I try to follow up back in time. Who are those that received adequate patient care? Who are those that didn't receive? And then I will come up with an association. Let's go to the next slide. Descriptive studies as another type of research design. Descriptive studies in research are a type of research design that aim to describe the characteristics of a population being studied. You get it, eh? Yeah, we are not aiming at giving you details on intervention. No, we just want to provide you with information about that community. You get it, eh? Yes. These studies focus on providing a detailed account of the subject and the information. They will give you information on, for example, pregnant women. You get it, eh? But they will not give you ideas on how you can better handle them. But they will tell you that pregnant women go through this. They are subjected to fistula. They have risk of hemorrhoids. You get it, eh? Yes, and other possibilities in line with that. Descriptive studies are often used in initial stages of research to gain a better understanding of the topic before complex research design are implemented. To understand this more, this is like basic research. You get it? It is that I can do a descriptive study first to obtain information on that community. You get it? For example, the impact of social media usage on teenagers in of teenagers' mental health. I can just assess teenagers on their mental health. I will not give you interventions. No, I will just assess and then give you information that if social media using this line and this line affects the mental health of the youth. Another good example is the population census. See, this is a descriptive research. It will give you a baseline information on the whole country, in the district, on the community. You get it, eh? Yes, it will give you that basic information, whereby other researchers can access that information and then foster their own research. You get it, eh? I might not need to again assess the age groups of those individuals because I have them in the population census. You get it, eh? Yes. Another slide, we get the details. Case reports as an example, as a type of descriptive studies. Yeah, case reports are a type of descriptive study that provide detailed information about one or more cases of interest. These reports typically focus on rare or unique cases, unusual presentations of common conditions, unexpected outcomes on novel treatment approaches. We had very many case reports during COVID-19 because it was a new condition. A new virus had come in. You get it? Eh? Therefore, the world researchers had to make sure, in case you get one case of COVID-19, you get an individual who is suffering from COVID-19, you get more information on this case, and then you produce a case report. You get it, eh? Sometimes now we are health professionals, eh? midwives, nurses amongst us. Yes. As we shall be at our health facilities, we shall receive very many individuals who shall present with a new condition that you have never seen. Sometimes you might have seen it, for example, sickle cell anemia. You might have seen sickle cell anemia, but again, a child presents with a protruded eye when the child is a sickle cell anemia child. You get what I'm saying? You can produce a case report here and say, yes, we know we have cases of sickle cell anemia, we have cases of protruded eyes, but not both cases combined. But here now, a child comes to your facility, the child has a protruded eye, and the child is anemic. You get it? So I can provide a case report to foster further investigation, because this is a new situation. A child, a protruded eye in a sickle cell anemia, or in a Ugandan sickle cell anemic child. You get it? Yeah, that's the importance of case report. So an example here is ankylosis spondylitis. That is a condition. Don't get scared of it. Yeah. Ankylosing spondylitis with peripheral neuropathy. Peripheral neuropathy is those nervous problems that affect the surfaces of our bodies. Yes. So someone might present with that condition, ankylosing spondylitis, and that someone also has peripheral neuropathy. And you find out that it is something rare, therefore you want to report it so that other researchers might get information on it. There are many health facilities. For example, me, when I was doing my internship from Gulu Regional Referral Hospital there in Gulu, we received a case who had two heads combined. Like, I mean, these were twins, but their bodies were combined and they had to get separated. You get it? And they successfully got separated. You get it? So such information, you cannot just keep it. You must publish it. You must present a case report and publish it so that the world learns about it. You get it? Yeah. Okay, let's go to the next slide. I don't. Okay. Yes, cases. Yes, case series typically involve the collection of data on a series of cases that share common characteristics. For example, a particular diagnosis or exposure to a specific risky factor. And the data collected may include demographic information, clinical features, treatment outcomes, or follow-up data. And then, by analyzing these cases in detail, researchers can identify patterns, trends, and potential associations that may warrant further investigation through rigorous study designs. In case I'm in my community and a certain outbreak comes, and this outbreak is a bit rare, you get it? Those days, people, there is a certain community in southern Uganda whereby people were having numbers on their backs. People were saying that this morning there are now 60 children. Each one is having a number on their back, and the condition was named a number. So for such a condition, you as a researcher, you must go and investigate on these children who are having those numbers on their backs. That are they really numbers? What is causing this? And then what you produce is a case series that from this person I obtained. We found out that this was it. When I went to the next person, I found out that this was the cause. That's why they are called series. Yes. At some point, you might have had a case this year, and then another case appears next year. You go and collect information. You get it? So, in other words, a case series is like a collection of case reports. Yes, a series. You get it? We collect information for the condition the day we have seen it. In case it presents again, we collect information on it. Presents again, we collect information on it. You gather that information in the subsequent presentations, and you come up with a case series. You get it? Yes. We use them in medical research to provide insights in rare diseases and unusual presentations of common conditions. I think that one is clear. Let's go to the next slide. Descriptive surveys. Yes. Under descriptive studies, a survey is the word to quote here. So this is the type of research method under descriptive studies to gather information about characteristics, attitudes, behaviors, or opinions of particular patterns. For example, we have introduced a new health worker in a hospital, and we want to assess on how he is doing. You get it? So we shall perform a survey among the by patients that he has admitted, and we try to ask them how his services are. That is a survey. Then another one, we can just go to a community, for example, population census. I've talked about it already. It is a survey. You get it? We try to go to the community, obtain epidemiological data. You get it? And we come up with a survey. We can perform a survey on non-communicable diseases. We go to a community, try to ask them. We don't check them, but we ask, do you have asthma? If someone replies yes, they have your record. Do you have high blood pressure? Yes. Do you have chronic obstructive pulmonary disease, COPD? They reply. After that, that is a survey. We have done a survey on any CDs, perhaps among residents of this and this area. You get it? This is survey. We make a report, and that is a descriptive survey. You get it? We describe about what is happening on any CDs in such and such area or on such and such age group. You get it? Yes. Researchers use descriptive surveys to answer questions. For example, what is the prevalence of this behavior? What are the characteristics of a specific group of people? You get it? Yeah, such questions are answered during surveys. Let's go to the next slide. Next slide, please. Yes, bias in research. Now, we reach our final objective of this lecture, and that is to discuss about bias. Yeah, so in research, bias refers to systemic deviation of results or inferences from truth, often influenced by researchers' preconceived notions, preferences, and beliefs. Yeah, as a researcher, that's the importance of a design now. It will limit biases. You get it? Yeah. Research which is based on a certain age group. Your research title is among adults. Adults we know are aged from 18 and above. But for you, we find out that most of your information you're collecting, it is favoring only those ones who are aged 65 years. You get it? That is a biased research. It must be favoring all and each and every one of your participants. So bias can come from beliefs. I can go to a community to assess about high blood pressure. However, I am very much aware that it is women who are having high blood pressure most. So I make my research design targeting women most. But your title is among adults. But because you have that information that I know this community, it has a lot of pressure in women. And then you favor only women in your design. That one is not advised, and that is what we call bias. So it can significantly impact validity and reliability of your research findings. Your research findings cease to be valid, and we cannot rely on it as researchers. Yes. So types of bias may be selection bias, confirmation bias, public bias, and others. We're going to see them in the next slide. Let's go to the next slide, and then we get the types, and then we have this session closed. Selection bias is that type of bias that occurs when participants in a study are not representative of the targeted population, and it will cause skewed results. Skewed results and those that we cannot rely on them so much, or whereby it is a generalized study, but results are almost only for those ones who are aged 50 to 40 to 50. You get it? Skewed results. They are not beating the mean. You get it? The mean of your study. Confirmation bias. Researchers may unconsciously seek out information that confirms their hypothesis while ignoring contradictory evidence. Evidence on that problem they are researching about. All of these biases so much arise when you, the researcher, you have prior information on that village. It is your own village where you live. So since you are now almost the key informant of that village, when you're making that research design, you try to be based on something, and then you try to hide other would be important evidence. Perhaps if you would reveal it, it would cause cancellation of your design, of your research. You get it? So then you intend to leave it out. That's a bias. Then publication bias arises when studies with positive results are more likely to be published than those with negative results. You get it? Leading to incomplete understanding of the topic. For example, the effect of raw salt use on hypertension. Some would say, but taking raw salt does not affect hypertension, does not cause hypertension. Others would say, no, it causes. Now, you find out that in case someone makes a research, they identify that their result is negative, they fail to publish it. But they have found out that raw salt does not actually cause hypertension. But because in their head they know that according to previous researchers, it says it causes. How can I say that it does not cause? If they don't fail to publish, they will change the results and say, yes, it causes. Yet actually what he found out was that it does not cause. You get it, Publication bias. Let's go to the next slide. And the last one. The next slide. I don't know why it's not. Okay, reporting bias. Yeah, researchers may selectively report only certain outcomes of the data that support their conclusions, omitting relevant information. For example, you might enter your research with very many variables: age, sex, education, levels of education, income, level of income. You get type of employment, but you find out that the type of employment is not favoring your conclusion. You wanted to generate a certain conclusion, but the type of employment variable is not favoring it. You decided to neglect it. You say, let me put this one out. You get it, Or in case the level of education is not favoring your conclusion, you decided to put it out. You get it, Yes, that becomes a reporting bias. You don't report it. Yet in your research design, it was there as a variable. You get it? That is a bias and it is not advisable. It is bad. Then lastly is sampling bias. This occurs when the sample used in the study is not randomly selected, leading to results that cannot be generalized to the larger population. For example, you might be generating a sample, but it does not actually represent very well the entire population. You get it? Your study is about adults aged 18 years and above. However, when you select the sample, we are seeing that most of your members are aged 60s. You get it? Or we find out that it's now more youth in your study than others. You get that becomes the sampling bias. You poorly selected your sample. This marks the end of today's lecture. In case there is any question, I would welcome it. However, before I conclude everything, I urge you start coming up with a topic. Next week, I will be on your next so much demanding for topics. You get it, Start thinking of a topic in your community. We are health sciences students. Think of something to solve, and that's the way to go, and that's how we shall benefit from this module. Thank you, and thank you so much.